Hello and welcome back to the Armor Men's Health Show. I'm Dr. Mystery, your host, board-certified urologist and founder of NAU Urology Specialist, joined as always by my co-host, Donnelly.
Hey, everybody. Listen to our podcast wherever you listen to podcasts. And by the way, Dr. Dellinger, yours are some of the most downloaded that we have.
Are they really?
Mm-hmm.
So we once again have Dr. David Dellinger joining us. He's a plastic surgeon, and he and I work together on a number of cases. You may not even think that a urologist and a plastic surgeon would have so much fun in the operating room together.
Is that what we're calling it? Fun?
Fun in the operating
That's
room
right.
together. So in our last segment, we talked about the buried penis and the reconstruction that we do for people who have kind of a turtling or an internalization of their penis. They're not able to hold it when they're standing to urinate, and they may even have, a complete absence of sexual functioning if they can't get their penis out. But another big thing that you and I work together on is penis enlargement surgery. Now, this is a little bit more of a fun topic when we talk about it, but whereas we've normalized breast augmentation and lip augmentation and butt augmentation and kind of the use of cosmetic surgery in women, the use of cosmetic surgery in men still kind of lags behind, but it makes up a big part of your practice, right?
These days, I would say that it probably accounts for almost half of our practice, male aesthetics.
It.
Yeah.
So
that's awesome.
What are some of the things that men usually seek out when they're looking for male aesthetic surgery?
Obviously, the number one thing that we get people looking for is girth enhancement or penis enlargement. That's my most popular one. Also, we were just talking about the fupa, which is another area where guys are looking for different ways to decrease the amount of fat that they have in that area. You can definitely get more functional length just either with some weight loss or with the removal of some of that excess skin and fat. Maybe they're not quite the extent of the buried penis issue that we were talking about before. And then guys are also coming in for, we do hair restoration is a big popular topic for us.
Are men doing Botox and facelifts and all that stuff that we used to think about in the past?
Not so much facelifts because there are so many like non-surgical alternatives. But Botox, there's plenty of guys coming in for Botox and other types of laser facial treatments that we can offer. So yes, there's a lot of things. Gynecomastia is another thing that guys come in with.
Which is abnormal enlargement of breast tissue?
That's correct, yes. And that's a nice, easy, satisfying surgery that many, many men say, look, I won't even cut the grass in my backyard with my shirt off because I'm so uncomfortable with how I look. And next thing you know, they can go hang out at the beach without their shirt on and feel much better, much more comfortable.
The wife's like, why are you moving to Venice Beach, honey? Because I can be shirtless all day.
Look at these guns. And so now a lot of the cases that you do are done right in your office. So let's say somebody was just embarrassed about the idea of having to go to a hospital or have something done kind of in public. Most of the stuff that you're talking about is done right in your office, right?
Yes, the vast majority of it is. We have a surgical center that's certified through the state, and we offer the same safety and much more privacy than you're going to get going to a hospital or a public surgery center.
And I think that, I think men may not have the comfort level talking about cosmetic issues, even with a doctor, like a woman would because of how normalized it becomes. But really understanding, if you're a listener out there, that these things are normal to talk about with a plastic surgeon, that if you're not happy with your breast tissue, if you're not happy with kind of how you're aging, that there are resources out there to help you feel and look better.
You're exactly right. As you mentioned more, many of these procedures for women are very mainstream. Even breast implants, even 20, 30 years ago.
I mean, women tell you that they got their breasts done.
Now, you used to sort of sneak into the office.
You had to sneak in.
Now they go to brunch and drink mimosas and talk about who did their breast surgery.
That's right. It's a very different kind of. I mean, I can't imagine me and my friends would sit around talking about who made my penis bigger.
Yeah, you're probably not going to.
But that's what you do at work. We hear about it all day.
We do hear about it all day.
You're probably not going to sit around and watch football with your friends and talk about.
Look at this.
Look at this. You won't believe what I brought home. So when it comes to penis augmentation surgery, once again, normalizing the discussion, I think, is important. I think that as a society, we feel like an over-dependence or an over-focus on how your penis looks to you is something that we don't encourage. Because we consider it to be a vanity issue. So what are some options men have currently in the marketplace, not just those that you offer, that others offer as well, for making their penis, let's just say, bigger as a general term?
I mean, there basically are four options. One is there's a type of silicone implant developed by a guy in California.
What is that called? The pneuma?
Yeah, pneuma.
So the pneuma is like a silicone implant installed underneath the skin.
Yes.
And the biggest pneuma guy in town stopped doing them.
He said, don't Google that procedure. He said it's frightening.
And there's a recent article in ProPublica that was also reproduced in Texas Monthly that's called The Secret World of Penis Enlargement, and they focus on that procedure. And they don't exactly have really nice things to say about it. The complication rate is much more significant than other types of implant procedures, such as...
It's significantly different than putting a silicone implant in breast tissue.
Exactly, yes. Very different. You should see a 2% or less complication rate with breast implants, and their reported numbers are in the 20% range.
Wow.
The skin of the penis is very thin, and the penis itself has a hard time like handling the weight of a silicone implant. That's my impression when I see these things post-operatively. So besides the silicone implant, what are some other options?
There's fat grafting, which is similar to how women get Brazilian butt lifts, where you liposuction some fat, process it, and then re-inject it into the penis area.
On an aside, the Brazilian butt lift does what?
You do liposuction, usually on the abdomen. You process the fat, and then you put it into your butt.
You get
do?
a Cardi B butt.
There's no lift? It's just bigger?
It's just much bigger.
Oh.
Oh, I thought there was a lift involved too. I guess
the Brazilian butt lift has a really good PR person.
when I become a rapper, I'm going to go get my butt lifted or poofed.
And so when you put that fat into the penis, you put it underneath the skin or deeper?
You put it pretty much just right underneath the skin.
And doesn't it get all lumpy? Like, it seems like it would get real lumpy.
The results, I mean, I would say of the 30, 40 patients we've seen that have had fat grafting previously, I would say 3 or 4 of them had pretty reasonable results, but a lot of them are not very happy with the results. The texture and the feel, even when they have erections, is not very normal. The appearance is not very normal, so they really don't care for it that much.
And the fat goes away, right?
The fat will eventually, it's considered a semi-permanent.
Gotcha.
Yeah, so it will last, quite a few years, but you will lose anywhere between 30 to 70% of the fat that's injected. It doesn't survive the transfer process. So there's always that issue you mentioned with lumpiness and scarring that can occur.
What's the third?
The third is temporary fillers like Juvederm or Voluma, the hyaluronic acid-based fillers. That
you can use temporary fillers.
You can, but you're just kind of looking down, watching your money dissolve in front of you. We've seen people come from other places that spent, $8,000, $9,000 for 15 syringes that went away in 15 months. So that's kind of like watching your money dissolve in front of you.
Well, now she's married to me, so she's got to deal with whatever she's got now.
Stop.
And your fourth option, which is the one that you do mostly.
It's the one that we primarily do. It uses a different type of filler called a biostimulant, which instead of dissolving, it causes your body to produce some new tissue in the area. It does that by causing a mild inflammatory response. Inflammatory sounds bad, but basically, if you cut yourself shaving or sustain any kind of little injury to your skin, that causes an inflammatory response that causes your body to come in and grow in new tissue and heal. So that's what we're trying to do. We're trying to stimulate the growth of your own body's tissue to achieve a permanent result.
So what can somebody expect as the process if they're coming in to get this biostimulant?
The reasons I like it, besides the permanence issue, it's easy to get done. There's no anesthesia other than a topical cream that we put on to numb everything up. You're only in the office for a couple of hours. You can drive yourself home. You can usually go to work the next day. You can work out within a few days.
And the girth enhancement, there's a significant improvement right away.
Oh, definitely. Usually 3/4 of an inch to an inch improvement in girth with one treatment, which, if you do the math, it equates to somewhere between a 30 to 40% increase in volume overall.
So you do this procedure, it takes a couple of hours, and you can have it done again if you needed to.
Most patients do come back. It's like how much money you have in the bank. You wouldn't mind having some more. So most patients do come back for a second treatment, probably 90%.
Does it alter sensation of the shaft of the skin when you're having sex?
It does not. No, it does not affect your function. It doesn't affect your sensation. It looks and feels normal.
And you would say that for the most part, the partners seem to be pretty pleased.
Yes, definitely. We've never had anybody come back and say it made my sex life worse.
Well, Dr. Dellinger, as always, an amazing conversation about plastic surgery and urology, how they overlap. I can't thank you enough for giving our listeners this great information. How do people make an appointment with you? You
can call our office at 512-229-1978 or go to our website, Elysian, Elysian, plasticsurgery.com.
And if you are a patient or a listener out there that wants to go through a urologist, we work very closely with Dr. Dellinger. He is our go-to plastic surgeon. Donna, how do people get a hold of us?
You can call us at 512-238-0762 and visit our website, armormenshealth.com. And remember to listen to our podcasts wherever you check out free podcasts.